This vitamin D post is really important. It's one of the most important supplement posts that I think that you should be listening to. And I want you to have this information so that you can ask your doctor the right questions and make sure that your supplement agenda addresses one of our most important needs for our body. And it's especially important if you're in menopause or heading into menopause, because that's when things really start to drop from a hormonal level. And you need D3 to supplement a lot of your bodily function. So you have to get it in the right form. We've known forever that low levels affect our bones, but over the last 5 to 7 years, the science has really shown us that D3 affects so many more functions of the human body. It affects your immune system, it affects neurological disorders, it affects basic functions like your thyroid, it affects inflammation, and it affects mood disorders like depression. So when you start heading into these over 40, over 50 years, your D levels become so much more important because so much is working against you. So where do you get it? The sun. And what are we doing? We're putting zinc on our body to block the sun. We're putting clothes on our body. We're wearing hats. We're staying in the shade. We're doing everything we can to stay out of the sun for perfectly good reasons. In addition to sunblock, there's all kinds of things that get in the way of us getting the sunshine. There are seasons, there are where we live, there's seasonality, there's environmental factors, there's pollution, there's all kinds of things that get in the way of us getting that sunshine that we need. So we have to get it through supplements. If you can't get it through food sources and you can't get it through pure sunshine, then you have to get it through supplements. And it becomes really, really important how you get it and how you make sure that it's absorbed and assimilated into your body to make sure that you really get that cell benefit out of it. We supplement and we take vitamin D3, which is so important for us to get into our system. But what's also important is the cofactors that it needs to make sure that it gets absorbed and assimilated into our body. And there are a few of them that you really need to make note of. Some of the important cofactors that make it so that vitamin D3 is more effective: a good food and exercise program. So you have to make sure that you're getting a good nutritionally balanced diet. You have to make sure that you're getting magnesium and the right type of magnesium. You have to make sure that you're getting K2 to bind with it. And then you have to make sure that you're getting zinc and boron. That whole assimilation plus omega-3s are going to be really important to make sure that you get the totality and the benefit of the D3. So what you need to do is you need to take this information, make sure that you really incorporate it into crafting your supplement lineup. If you want to know the supplements that I use, I did a video on it just a couple of days ago. If you want to go get that, make sure you go to your doctor and you test your D levels. Make sure you measure the progress that the supplement is having through regular intervals. And it's really, really important. It really just supports your entire bodily function. And eventually that will really benefit your heart, your mind, your skin, and all of the functions of your body. This is the one supplement video that really affects every part of your health. So I hope this made you a little bit more aware of some of the questions that you can ask your doctor and really just take a lot more control over your health agenda, your supplement agenda, and just your overall health initiatives. I hope this is helpful. I'll talk to you soon.